When pain keeps finding its way out, it's not just discomfort, it could be a fistula. Welcome to Ayur Varta with Dr. Pooja in association with Aviral Hospital. And back in conversation, we have with us Dr. Sandeep Mishra, sir. So
Okay.
we welcome you.
Thank you, ma'am.
And since we are in a series of piles, fissure, today's topic is really important one. It's fistula in ano.
Okay, ma'am.
Coming directly to the question, so what is fistula? Why are people so scared about fistula?
Fistula is, ma'am, basically an abnormal communication between the skin surface and the anal canal. So there is a communication through which sometimes pus, sometimes blood, sometimes mucus discharge is coming out of the external opening.
Okay, sir. So piles और fissure से fistula का क्या connection होता है? Are they all related?
Ma'am, frankly, they are not so much related. But if you ignore one disease, there are chances of becoming some another disease. Like if there is piles, there might be chances that there is raw surface, and due to the infection of that raw surface, there may become anal glands may get infected, and there may become fistula. Just like that, in the fissure also, there is, as I told in the previous video, that there is a linear ulcer. Fissure is a linear ulcer. So if anyhow the bacteria enters in that ulcer, then it forms an abscess, and that may lead to a fistula.
Fistula. Okay, sir. What are those early signs that can help a patient identify that it's a fistula?
Ma'am, in the very beginning, if you have any boil or any small pus discharging opening near the anal canal in the perineal area, then you should think of it might be a fistula. Rather than thinking just a small boil, you should think of it might be fistula.
ओके सर तो क्या बार बार पस या डिस्चार्ज आना एक वार्निंग साइन हो सकती है?
डेफिनेटली मैम, दैट इज व्हाट आई वांट टू से कि अगर बार बार पस आ रहा है, म्यूकस डिस्चार्ज आ रहा है या उस ओपनिंग से ब्लड आ रहा है, तो आपको सोचना चाहिए कि ये एक फिस्टुला की ओपनिंग हो सकती है और इसका ट्रैक अंदर की तरफ जा सकता है। तो जितना आप इसको इग्नोर करेंगे उतना इसकी ब्रांचिंग हो सकती है और ये डीप भी जा सकता है। तो समय रहते आपको चिकित्सक से मिलना चाहिए।
ओके हाउ यूजफुल इज सेल्फ मेडिकेशन घरेलू नुस्खे अपनाने लगते हैं लोग हाउ गुड इज इट?
Ma'am, it is good for fissure, it is good for piles, but it is not good, not at all good for fistula
फिस्टुला
in ano.
ओके सर
Because fistula in ano is inside disease that pus is collecting over there, it is forming over there, and it is finding its way to come out. So, how more you delay, more it becomes complicated.
ओके सर so is it an infectious disease or is it lifestyle related disease?
Ma'am, both. It is infectious disease as well as it is lifestyle related disease. It is mostly found in the obese patient. It is mostly found in the diabetic patient, tubercular patient, as well as patients who are having sedentary lifestyle.
ओके सर
So it is infectious as well as lifestyle disease.
lifestyle disorder okay sir what are the common diagnostic tests that we suggest to the patients और ये क्या सच में पेनफुल होते हैं सर?
Ma'am, we go for MRI fistulogram, which is the gold standard test for fistula.
ओके सर
There are two techniques. One is plain, and one is with the contrast. So not every time contrast is needed. So just we go for MRI fistulogram. It is not at all painful, but there may be pain when the technician is injecting some dye. There may be
ओके
some
सर
pain, but otherwise it is painful,
सो इट्स
painless.
अ बेरेबल पेन
Yes, ma'am. Yes,
ओके
bearable.
सर सर एक और चीज पूछनी थी कि सर्जरी के बिना भी क्या फिस्टुला ठीक हो सकता है और सर्जरी इज ऑलवेज द ओनली ऑप्शन?
Surgery is always the only option in this case, particularly fistula in ano,
ओके सर
because it is a foul granulation tissue inside the fistula tract, which is keeping it the tract patent. So it cannot be treated by antibiotics. It cannot be treated by any medicine. So it needs surgery.
ओके सर ट्रीटमेंट अगर डिले किया फिस्टुला का तो व्हाट कैन बी द प्रोबेबल कॉम्प्लिकेशंस?
Ma'am, if we delay the treatment of the fistula, then it may develop some branches. It may lead deeper extension, and the simple fistula can become complicated fistula. The grades can rise,
ओके
and
सर
sometimes abscess may form in deeper tissues. So one should not delay the treatment of the fistula.
not delay the treatment of fistula is the point.
Yes,
Okay,
ma'am.
sir. And fistula से बचाव के लिए वो कौन सी daily habits हैं which people can follow?
Again, the same habit, you have to increase the fibrous in your diet. You should not avoid the urge for defecation. You should not have sedentary lifestyle. You should be active in life.
Hmm.
Long sitting should be avoided. So if you follow these things and avoid maida and spicy foods, so I think you can prevent yourself from getting a fistula.
ओके सर। सर आयुर्वेदा में फिस्टुला के बारे में कहीं कुछ वर्णित है?
डेफिनेटली मैम, आयुर्वेद में बहुत ब्रॉड वर्णन है इसका। इसको भगंदर के नाम से बताया जाता है और भगंदर के टाइप्स भी सब बताए गए हैं, इसकी चिकित्सा भी बताई गई है और आचार्य चक्रदत्त ने इसमें स्पेशल टेक्निक छासूत सर्जरी भी बताई है, जिसमें पूरे ट्रैक में हम लोग छासूत पास करा के प्रोब के थ्रू और लाइगेट कर देते हैं, तो धीरे धीरे वो अंदर वाला फाउल ग्रेनुलर टिश्यू कट के हट जाता है और फिस्टुला ठीक हो जाता है।
ओके
सो इट इज
सर।
अ मैजिकल थेरेपी आई कैन से।
सो इज दैट सो कि इंटीग्रेटेड थेरेपी अगर हम अप्लाई करते हैं along with surgery if we are applying Shara Sutra that will be more effective?
Yes, ma'am. Nowadays, many institute are working in this. If we use adopt hybrid technique
Hmm.
along with the laser, along with the fistectomy,
Hmm.
when we reach the anal canal, then we put Chasutra. So, along with laser and Chasutra, we get early and permanent cure.
ओके सर। सर आपकी इतनी एक्सटेंसिव प्रैक्टिस रही है इन योर रेगुलर प्रैक्टिस व्हेन यू सी सच पेशेंट्स ऑफ फिस्टुला हाउ मच टाइम टेंटेटिवली इट टेक्स टू क्योर फिस्टुला कंप्लीटली?
Ma'am, it is very difficult to say, but it depends upon the length of the track. As in general way, I can tell you, it depends upon the length of the track in which Chasut is put. And around 1 centimeter track is
Hmm.
cut every week.
ओके
So it
सर।
depends upon the length of the track, that how much
Hmm.
is the length. If it is 4 centimeter, it will take 4 weeks. If it is 6 centimeter, it will take 6 weeks. So
ओके
like
सर।
that we can calculate. But most of the fistulas get cured in 1 to 3 months.
Okay, sir. So tentatively, 1 to 3 months is the time.
Yes, ma'am.
Okay, sir. Now, one last question, or rather, I would say the takeaway message for our UG students, PG students, and our audience.
Yes, ma'am. My take home message is that if you have any boil, any opening, any papule or macule in perianal region, get it checked by a surgeon, anorectal surgeon, as soon as possible. Because if you just think that it is just boil, then it keep on extending inside and it will be becoming greater and great fistula. So get it cured as soon as possible.
Okay, sir. So thank you so much on providing so much of information on fistula. So, guys, silence delays healing. If signs persist, please don't wait. आगे की वार्ता in the next episode. Till then, स्वस्थ रहें, मस्त रहें, व्यस्त रहें. धन्यवाद.
Thank you.